Hello and welcome. What you're seeing is the Compat Enteral delivery system in action. Developed with the help of nurses around the country, the Compat pump is designed to be easy to use while providing quality nutritional care for your patients. Compat's accurate delivery and constant rate of flow can help solve the problems of gravity delivery systems. Continuous pump infusion also offers substantial benefits over intermittent and bolus feeding. These include reducing the incidence of common tube feeding complications, such as GI discomfort, diarrhea, and volume-related intolerance. Compat also saves valuable staff time. In this program, we'll be discussing the main features of the Compat Enteral pump, and then we'll demonstrate the proper use of the Compat Enteral delivery system. You'll find that it is as easy to use as it is effective. The Compat Enteral delivery system consists of three major components: the feeding container, the administration set, and the enteral feeding pump. The feeding container can be either an open or closed system. The open feeding container uses our semi-rigid container or vinyl bag. Both come with pre-attached administration sets. The closed system uses a spike set inserted into a pre-filled container. The third component is the enteral feeding pump. The Compat pump is lightweight, portable, and easy to use. Our 199235 model provides a dose limit feature for intermittent feeding with a choice of 3 dose complete alarm options. The accumulated volume display provides a record of all formula received over several feedings. The Compat pump memory retains all these features as well as the infusion rate and volume delivered. Now let's examine the Compat pump's features one by one. The keys on the front of the pump are used to turn the unit on and off and to increase or decrease the flow rate and dose limit settings. The setting can be clearly read on the 2 display windows. Adjustments from 1 to 295 milliliters per hour are in 1 milliliter increments. The volume delivered readout, which is constantly displayed, shows you the total amount of formula delivered. This readout also serves as the dose limit and accumulated volume display. The dose limit set key allows you to set and view the dose limit. This key is also used to view accumulated volume. The total reset key will reset the volume delivered to 0. The run-hold key is used to start the pump. It is also used to stop the pump temporarily to correct an alarm situation or adjust the settings. For the safety of your patient, there are several audible and visual alarms built into the Compat pump. The Compat pump can be operated using standard AC power or using the internal rechargeable battery. The light labeled BAT shows that the system is running on battery power. If the battery runs low, the low battery light will come on, indicating that it's time to recharge the battery. This alarm indicates that there is an occlusion in the system or that the container is empty. It will also display if there's a problem with the drip chamber or if the pump has been left on hold for more than 2.5 minutes. The dose complete alarm is activated when the pump has delivered the amount of formula equal to the dose limit set by the operator. At the completion of a dose, the pump alarm can be set to sound once every 5 minutes or continuously depending upon your preference. If an attempt is made to change the flow rate while the pump is running, an audible alarm will sound. Now let's take a look at the pump set assembly, conveniently located on the front panel. A set of electronic sensors is used to detect the flow of the formula. These brackets located below the sensors hold the drip chamber in place. The rotary peristaltic pump mechanism, or rotor, is located below the drip chamber brackets. This rotor delivers formula by compressing the tubing around the rotor to push formula through the administration set. On the back of the pump is a handy built-in pole clamp for quick and easy attachment to an IV pole. The alarm volume control dial, which allows you to adjust the volume of the alarms, is also located on the back. The volume can be adjusted but not turned off. The power cord can be neatly wrapped away when the pump is not in use or when using battery power. Now let's demonstrate step by step the operation of the Compat pump. For quick reference, the main steps of operation are listed on the side of the unit. The first step is to clamp the pump to an IV pole and plug the unit in. The Compat packaging is color-coded for pump or gravity administration. For this demonstration, we're using a 500 milliliter semi-rigid container with pre-attached pump set. These single-use disposable units come individually packaged and have directions for use printed clearly on the back. The package is perforated for easy opening, and a patient label is included with each package. Now let's begin. First, we remove the container and the pre-attached administration set from the package. Lift the hanger rings and hang the container on the IV pole. For ease of assembly and sanitation, temporarily place the rolled tubing in the pump handle. Fill out the patient label and attach it to the container. To fill, first close the roller clamp, then remove one hanger. Note how the container tilts for easy filling. Remove the cap and place upright on a clean surface. Transfer the formula into the feeding container. Be careful not to touch the inside of the container. When finished, replace the screw cap and rehang the container. Next, remove the administration set from the pump handle and snap the drip chamber into the drip chamber brackets. Be sure the top of the drip chamber is positioned correctly. Remove the protective cover from the feeding tube connector and open the roller clamp completely. The Compat drip chamber has been designed so there is no need to partially fill the drip chamber with formula. Note that the drip chamber must remain empty for the pump to operate. Allow the formula to fill the tubing to a point a few inches from the end of the feeding tube connector. Immediately close the roller clamp. Next, grasp the pump adapter portion of the administration set and carefully stretch the silicone tubing around the pump rotor. Insert the pump adapter into the right-hand brackets. The tubing fits here, in the tubing guide. Then insert the feeding tube connector into the feeding tube. Now we're ready to start the pump. The Compat pump can be used for continuous feeding or dose limit administration. Our first demonstration is of a continuous feeding using the Compat 500 milliliter semi-rigid container or open system. First, turn the unit on. The Compat pump has the capability to retain the previous infusion rate, volume delivered, dose limit, and accumulated volume. This memory feature saves you time. You will need to verify the settings stored in the pump's memory. Look at the infusion rate display. If the rate is not correct, set the proper rate by pressing the increase or decrease key. For this patient, we will set the rate to 60 milliliters per hour. Next, return the volume delivered setting to 0 by pressing the total reset key. Then check the dose limit by pressing the dose limit set. Since this patient is on continuous feeding, there should be no dose limit appearing in the dose limit display. If a dose limit does appear, press decrease until the display reads 0. Next, open the roller clamp. Then push the run-hold key. The rotor will begin to turn, and the volume delivered display will stop flashing. The rotor hesitates periodically to conserve battery life. This is normal. It does not affect the accuracy of the infusion rate. If the infusion rate needs to be changed at any point, push the run-hold key first. This will hold the formula delivery until the proper change has been made. Now let's show you how to use the time-saving dose limit feature. This feature allows you to set a predetermined amount of formula to be delivered and alerts you when this volume has been administered. Operating the pump is basically the same as already described. However, in this second demonstration, our patient will be receiving formula in a pre-filled container or closed system. First, the protective cap is removed from the container. Then, using both thumbs, the Compat spike set is inserted into the spike port. The formula is then hung on the IV pole using the built-in hanger ring. Turn the pump on and set the infusion rate as before. To enter the desired dose limit, press Dose Limit Set, and then immediately press the increase or decrease key until the desired dose appears in the display. Increase or decrease must be pressed within 3 seconds. Otherwise, the display will return to the volume delivered mode. When the dose is complete, an alarm will sound twice and the pump will stop. If desired, you may change this alarm to sound every 5 minutes or continuously once the dose limit has been reached. To change the dose complete alarm, hold the increase and decrease keys simultaneously for 5 seconds. A series of 8s appear in both display windows. Continue holding the increase and decrease keys and note that the infusion rate window now displays 0, 1, 2, and the volume delivered window displays 3, 4, 5, 6. Release the increase and decrease keys when a 1R, 2R, or 3R is in the rate infusion window. This number identifies the dose complete alarm mode that the pump is currently using. Press the increase or decrease key to select the desired dose complete alarm. By selecting the 1R mode, the pump will sound twice when the dose is completed. In the 2R mode, the alarm will sound twice every 5 minutes. If you wish to have the dose complete alarm sound continuously, select the 3R mode. You must press the run-hold key to save the selected dose complete alarm option that you just selected, then turn the pump off. When the dose complete alarm is sounding, the volume delivered display and the dose complete visual alarm will flash. To stop the dose complete alarm, you must either press the off key, which turns the pump off, or you must administer another dose. To administer another dose, you must clear the volume delivered display by pressing the total reset key and then press Run. This patient will now receive another 500 milliliters of formula. After several feedings, you may wish to view the accumulated volume of formula that the patient has received. To do so, press Run-Hold to stop the pump. Then press and hold the dose limit set key for 5 seconds. An abbreviation for total volume is displayed in the infusion rate window, and the accumulated volume of formula is displayed in the volume delivered window for 10 seconds. To clear the accumulated volume for the next shift or day, press Total Reset during the 10-second display. Now let's discuss the pump's alarm features. If the pump is left on hold for more than 2.5 minutes, an alarm will sound and the display panel lights will flash. Press the run-hold key once to clear the alarm and again to allow the infusion to continue. If an attempt is made to change the rate without first pushing the run-hold key, an alarm will sound. If it is necessary to clear the volume delivered displays, simply push the run-hold key, followed by the reset key. This will not affect the infusion rate. If the set should become dislodged from the pump during delivery, causing the formula to gravity flow, a free flow alarm will display and a continuous audible alarm will sound. Press Run-Hold and correct the situation. Pressing Run-Hold again will allow the feeding to continue. When operating the pump under battery power, the battery indicator light will be on. At a rate of 100 milliliters per hour, a fully charged battery will last about 8 hours. If the battery runs down, the low battery light will come on. The pump will continue to operate for about 15 minutes. If the pump is not plugged in within the 15 minutes, the low battery light will begin flashing and the alarm will sound and the pump will stop. Resume operation by plugging the unit into an AC outlet. Clear the alarm by pressing Run-Hold to restart the pump. Use a soft cloth or sponge and some warm soapy water to clean the pump housing and rotor. Never immerse the pump in water or cleaning solution. Use a cotton swab dipped in isopropyl alcohol to clean the drip sensors. If you encounter any difficulties in operation, you can refer to the Compat troubleshooting guide, or if you need further assistance, call your local representative. Never try to make repairs yourself. That's all there is to it. The Compat Enteral delivery system is easy and effective. It will help you save valuable time while helping your patients receive high-quality nutritional care. For additional information on the complete line of Compat pumps or other products, such as standard and specialty formulas, oral supplements, and specialty feeding tubes, contact your sales representative